Medical marijuana, in plain English. Marijuana has been a topic of much debate in the last 20 years. The main debate is, should it be legalized for medical purposes? And if it is legalized, should each individual state or should the federal government decide on laws and regulations? Medical marijuana has been a great aid to some people that have been diseased. Patients with AIDS, back trauma, and glaucoma have found that medical marijuana has helped them relieve the pain and some of the symptoms of their diseases. People who suffer from AIDS found that consuming marijuana has helped combat nausea, loss of appetite, and anxiety. However, the effect of THC, the active ingredient in marijuana, only relieves symptoms and does not cure them. However, the actual helpfulness and side effects of the drug are uncertain because the Food and Drug Administration and other medical associations have never approved of marijuana being an acceptable medicine. In 1995, the state of California first proposed Proposition 215. The proposition would allow for patients who received a valid doctor's recommendation and their primary caregiver's permission to be able to grow and use marijuana for medical purposes. With a 55% approval rate, the proposition passed and became known as the Compassionate Act of 1996. Since the passing of the act, there's been a major influx in marijuana dispensaries. There are now 16 states that have legalized the use of medical marijuana. Although these states may have legalized the use of medical marijuana, it is still illegal according to the federal government. During the Clinton and Bush administration, the DEA raided the state legalized dispensary. The DEA is a federal organization that follows the federal law, therefore their actions were legal. In 2007 alone, there were 50 raids. The agents of the DEA and their supervisors have said that these raids are just and due to the Supremacy Clause, the states have directly violated federal law. During the current times of the Obama administration, the president has stopped the federal government from raiding dispensaries, but does not support the legalization process. The supporters of medical marijuana say that it really does help relieve the pains and anxiety of diseases. However, the opponents of this strongly voice their claim. The federal law regarding the Controlled Substance Act classifies marijuana as a Schedule I substance. Other Schedule I substances include LSD and heroin. It also states that there is no medical value to using marijuana as medicine. California has started to instill a policy of taxation of their medical marijuana. There have been a projected $1.2 billion in revenue for 2012 if they're taxed $50 per ounce. Medical marijuana has many benefits when it's used for some diseases. However, marijuana is a banned substance and is illegal in the United States.